Good morning. Running a little early this morning just to get a little bit more privacy on the trail here on the canal. But so hopefully the brightness is okay on the screen. But today I wanted to talk about one of the topics that's in my mind more recently, and that has been the topic of burnout. I am a physician. I've spent 8 years as a critical care neurologist. Made some recent changes in my life. Professionally, still a physician, still taking care of patients, and still evolving in terms of, what I'm going to focus on as a physician and a neurologist, in my career. But I made some changes in my life, and burnout certainly has been a factor in terms of the transition that I made more recently. But I think there are a lot of misunderstandings and misconceptions about burnout and how to address burnout that I want to talk about today. And I want to really talk about it from my perspective. So I've spent the last 8 years of my life doing critical care neurology as one component of my clinical work, and I absolutely loved it. I dealt with children with acute brain injuries who were really critically ill, and families in really dark moments. And it's not a job for everyone. There's a lot of sadness and shock and chaos that goes with the job and goes with the conversations that you have with families in those sort of situations. These families are at unbelievably vulnerable positions. They are experiencing the chaos of a new situation in their life where a child may have experienced coma or a brain injury and they're just going through absolute hell. And my role is to help understand the brain injury, help treat against it in these situations, and to also be able to communicate very honestly with families about how things are going to go and how I think things are going to go. And then also I had the privilege of seeing these patients in clinic and helping guide these families and these patients during that time and through their process, and it just was like an absolute privilege to be able to do. With what I was doing, I was on call 23 to 26 weekends a year. I worked those weekends, and people thought what I was doing was kind of insane in terms of my workload. I liked how I liked the job, and honestly, a lot of people had talked to me. With the work that I was doing, I was on call and in the hospital on service 23 to 26 weeks a year, including weekends. And when I wasn't doing that, I was in clinic. And a lot of people were concerned that I was going to burn out and that this was too much work. And a lot of people warned me about that and talked to me. And what a lot of people said as a prescription to my situation was to be able to find ways to take it more easy, or to ask for changes to my schedule that made things easier on me, that put less demand on the work that I do. And at the time I was, I think the value that I was getting out of it, whether it be the work the autonomy, the feeling of reward and satisfaction, the feeling of appreciation, and the compensation was all of that combined was, I was pretty happy with when I was doing it. And so I did not have an intrinsic desire, to reduce my workload. I'm an individual, maybe I'm different, I don't know how to describe it, and I don't want to speak too highly of myself, but I am an individual who gets up at 3 in the morning or 2 in the morning sometimes without an alarm clock. I go to bed around 8 p.m. I don't set an alarm clock, and at 2 to 3 in the morning, my body just wants to get up and get going. And I'm still that way. I was that way when I started my job 8 years ago as an independent physician after residency and fellowship, and I still am that way. And so I think if I were to stop, and my wife knows this, if I were to, stop working, I'd still want to get up at 2 to 3 in the morning and be doing something that I want to do. But I did experience burnout. I don't want to go into the details, but, with respect to, I don't want to go into specifics of the details, but I will say that, the aspects of what I was doing changed with respect to the value that I was receiving in relation to the effort I was putting. And I think that's super important, right? There's so many, burnout is a function of the relationship between the output and work that you put in and the reward and value that you receive. Both are important. The work you put in, the value you receive. So when people tell you that you might be burning out or you experience burnout, you have to think about both. You have to think about both the input and the output. There was no part of me that wants to work less. And when I mean work, not necessarily the job, but just putting out energy and value into the world. I still want to get up at 2 or 3 in the morning. I have the mental and physical health right now to still do that. Now, probably I should get better quality sleep. I'm working on that, and so I don't want to advocate for anybody to, have the same sleep quality as I do. High quality sleep, super important. But I want to get up in the morning without an alarm clock and just get going once my energy is up. And while I was burning out, it just had nothing to do with what I was, the energy that I was putting in. It had everything to do with what I felt like was the value I was getting back in return. There were changes that happened with respect to, that. The value I was getting back in return. There were decisions made and major changes that happened that impacted that significantly. And ultimately I decided I'm going to take my energy output in another direction because I was burning out. I think this is important because a lot of people I know, I'm in the I work in medicine. I deal with residents. I was a resident and fellow. The topic of burnout in medicine and healthcare and with physicians and residents and whatnot is extensively talked about. It's extensively talked about. But everybody in the industry focuses on the workload. They focus on the workload. There's so little emphasis on what is the value received and whether that can be modified. And I think that's really important for the individuals who are experiencing burnout. If you're experiencing burnout, I would be worried if your idea of, I'd be really sad and worried if your solution to burnout is to reduce the energy that you put out in this world that creates value, if we're living a good life, I really think that if you're living a great life, you want to put value in the world, and you want to keep doing it with all of the vitality that you have. If you have a happy, joyous, rewarding, loving life, that's the Valhalla that you're just putting. So you just want to use your time and energy to just create value in the world around you, and that's so important. And I think with modern work and modern jobs, there's an acknowledgement, and especially in medicine, there's an acknowledgement of burnout, but it all has to do with output. It all has to do with workload, and not about, how we really feel in terms of creating value in this world. So I think this is something super important to think about. People just don't talk about it at jobs, at the modern job. Like, they don't talk about like how the job can change, or the value system, be modified in a manner to create more value for the employer, for the individual, in a way that's really meaningful to that individual. How do you adapt the situation to make that person really feel like they're living an extraordinary life? We just don't help people in that manner. We really don't. At best, it's like, okay, let's lighten the load. And that just, maybe that's there for some people, but if you really are passionate about life, you don't want to do that. Like, you don't want to lighten the load. I mean, you want to transform your time and energy to provide love, value, and productive energy in this world. You don't want to shut it down. And I worry that for people who are trying to shut it down, like trying to just relax more, take it easy. I don't want to say this the wrong way. I mean, taking it, being at ease is not a problem. So don't take me, that might not be the right way to phrase it. But people who don't want to, who want to lighten their workload, but don't have anything, they're passionate about to exchange it in return. Like, I'm just worried that that's kind of almost like a sad, slow, energetic death. It's almost like a part of you dies in terms of your desire to live an extraordinary life. If you want to live life to its fullest, you want to keep doing things. You want to keep putting things out there. The standard employer may not know how to handle that for you, or may not be capable of handling it for you, quite honestly. But you do want to create value. You do want to create value. So for individuals who are trying to live a great life, and have high energy, and want to exert that energy in a meaningful and authentic manner, but are experiencing burnout, think about the output, right? Don't shut it down if you want to love and create value in this world. Don't shut that down. But look at the output of your situation. Look at whether the outputs are changing or not. Even if they're not changing, if they're not worthy of what you want to put out. And then make decisions accordingly. For me, I've made decisions in my life that don't have anything to do about reducing my work output. I don't have a desire to reduce my work output. I have a desire for my work output to transform into real value in this world, and as much value as I can provide. And that is the way I've decided to make these changes in my life. And I would encourage you to try to do the same thing too. If you love life, if you love providing value, if you love others and you want to spend your time and energy in making this world a better place, don't use burnout to reduce your effort and passion. Use it as an opportunity to transform what you do in a manner that creates value. So I hope that was helpful. Beautiful morning. I took a little byway here, which is a little bit more private. Actually, I got a really nice, pretty view of some of the mountains here in the East Valley of Arizona. I think you can probably see Red Mountain and Four Peaks on this gorgeous morning. Is Four Peaks out there? Yeah, I don't know if you can see it. But yeah, gorgeous morning. All right, anyway, that's enough for today. I will talk to you guys soon.